Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about the controversy and evidence backing up statin medication. Statins, good or bad? Why the popularity of cholesterol-lowering drugs sparks criticism. Perhaps it's human nature, but gaining popularity inevitably leads folks to criticize you. This concept applies to one of the most widely prescribed medications, statins. Statins are a class of medication used to lower low-density lipoprotein, also called LDL-C, or bad cholesterol. Cholesterol issues confuse people. Cholesterol is necessary for cells to function, but high LDL cholesterol in the bloodstream leads to heart disease and stroke. Excess cholesterol in the blood deposits in the arteries to create plaques, which narrow them. Plaques lower blood flow and block blood vessels, which may suffocate and kill parts of the heart or brain in a heart attack or stroke. According to the CDC, heart disease and stroke are the first and fifth leading causes of death in the United States, respectively. Risk factors for high LDL cholesterol include many things we can change: eating too many saturated fats, lack of exercise, smoking and drinking, too much stress, and not enough sleep. Unfortunately, there are also several risk factors we can't change: genetics, some medical conditions, advanced age, and race, with non-Hispanic white people at the highest risk. With several non-modifiable risk factors leading to some of the highest causes of death in the United States, it's no surprise that statins are so popular. The liver plays a major part in maintaining healthy LDL cholesterol levels by producing and removing LDL-C from the bloodstream. Statins work by slowing down LDL cholesterol production in the liver and helping the liver remove LDL cholesterol. When LDL-C levels in the liver drop, the liver compensates by removing more LDL-C from the bloodstream. A 2010 meta-analysis of 26 randomized controlled clinical trials found that lowering LDL cholesterol by 1 millimole per liter, around 39 milligrams per deciliter, reduces the risks of heart disease and related death by about 1 in 5, and lowers all-cause mortality by 10% over 5 years. Statins, when combined with diet and exercise, significantly lower LDL cholesterol and the risk of stroke, heart attack, and coronary heart disease deaths. Yet, in spite of these data and physician support, statins have come under significant controversy over the past few years. Why is that? I'll share with you my thoughts. One major source of controversy around statins pertains to side effects. As with all FDA-approved medications, research sites record side effects during randomized clinical trials, and the FDA evaluates the risk of side effects weighed against the benefits of a medication. Statins, among the most prescribed medications in the United States, come second only to aspirin in how much doctors discuss them. The incredible high use of these medications makes sense, with 700,000 or more people dying from heart disease yearly. But this popularity also means that even rare side effects can show up in significant numbers. The most common reason people stop taking statins is a group of muscle conditions collectively called statin-associated muscle symptoms, or SAMs. SAMs include muscle pain, weakness, muscle loss, and cramps. These symptoms tend to occur in large muscle groups like the thighs, back, calves, or my 32-inch ripped biceps. Maybe closer to 25 inches. Reported rates of SAMs vary widely. In randomized controlled trials, rates are around 1 to 2% higher than in placebo groups, but observational non-experimental studies show rates of 10 to 29%. One possible explanation for this disparity is the nocebo effect, where people experience and report symptoms just because they expect to have them. A 2020 study in the New England Journal of Medicine tested this effect in patients who would randomly take a statin, a placebo, or no medication for a month at a time and report symptoms. Over the course of a year, people reported symptoms like SAMs at about the same rate, whether on placebo or a statin. Other side effects which have been reported include liver disease, diabetes, cognitive difficulties including memory and brain fog, and hemorrhagic stroke. Though some of these have made for exciting headlines, randomized clinical trials give better context. Clinical trials have dismissed worries of liver disease and cognitive impairment. Statins do slightly raise blood sugar, but the risk of this effect is highly outweighed by improved cardiovascular health from lowering LDL cholesterol. As Dr. Michael J. Koren quipped on the MedEvidence podcast,
the number one side effect of statins is you live longer.
Statins are amazing medications which have proven efficacy for those with high LDL cholesterol at risk of cardiovascular disease. This doesn't mean they are the end of the line, however. For most people, statins are only part of their overall care. Evidence shows that maintaining a healthy lifestyle while on statins can help reduce LDL cholesterol levels and protect against heart disease. A heart-healthy diet includes many fruits and vegetables, whole grains and legumes, low-fat dairy, poultry, fish, and nuts, while keeping saturated fats low and avoiding trans fats altogether. For people with high blood pressure, reducing salt intake may also help. Beyond diet, regular exercise, sleep, maintaining a healthy weight, and avoiding tobacco are also important. As always, it's important to make sure a specific health plan matches your needs. Statins have a lot of evidence to back up efficacy and benefit patients, which leads to their popularity. But in this case, the popular kid also happens to be the good kid. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.